I think from a coronary artery disease standpoint, same as it is globally, the number one cause of death. In our country, it's the number one cause of death. And in our region, I think a lot of the reasons are going to be lifestyle changes that we need to make, lifestyle things that are modifiable that we aren't really addressing as a nation and as a community. There's still the major risk factors associated with coronary disease, which are applicable even to our community: inactivity, obesity, knowing your cholesterol numbers, diabetes. Family history you really can't change, age and gender you really can't change. But the things that we do have the opportunity to change, we're not doing it effectively. In our community, it's still going to be males over the age of 40 to 45 are going to be at increased risk. If you're looking at some of the social determinants, it's going to be people who have lesser access to health care. And then minorities, ethnic minorities such as African American males, seem to be at that high end of that spectrum, both for incidence as well as mortality associated with coronary artery disease.
Okay. Detection is really important, so go see your primary physician for a physical.
Absolutely. On a regular basis, yearly would be ideal, and that's even if just for preventative health care.
If you're not going in regularly, are there symptoms that you need to be watching for?
Absolutely. And the problem is that a lot of the symptoms are very vague and very general. They can go from anything like we described, the elephant sitting on the chest. But that's not always what people will find. We have a lot of patients who will come in and say that when they exert themselves, they get short of breath. I've had patients come in and say when they exert themselves, they'll become gassy, they'll start belching, and then it stops when they quit exercising. So I usually tell my patients who are at risk that anything that comes on when you exert yourself, that goes away when you rest, could potentially be angina. So whether it's belching, whether it's gas, whether it's neck pain, whether it's pain going down your arm or through to your back, anything like that that comes on with exertion and goes away with rest is heart pain until proven otherwise. So you should always try and engage in a healthier lifestyle, watching your diet, watching the salt intake, reducing the amount of alcohol consumption, getting into a regular exercise program. A lot of my patients are over the age of 50, and I tell them we're beyond the point of running marathons for the most of us, or trying to make the Olympic team. So we don't have to be crazy with exercise. But if you can get on exercise moderately for 30 minutes, 5 to 7 days a week, that will make an incredible difference in your overall sense of well-being, as well as reducing your risk factors. As far as diet goes, a lot of times it's faster and easier to run to a fast food place and grab a burger and keep going. But we also have to stop and look at the fat content of the food, the salt content of the food, the carbs, all those things that are in there that can be detrimental. It's almost less expensive at times to go out for fast food than it is to sit at home and cook for yourself. But we also realize that the price down the road is where we're going to pay that, with obesity, with high cholesterol, with high blood pressure, increased risk of stroke, increased risk of heart attack, all those things that could potentially shorten your life. Well, when we talk about ischemic heart disease, we are talking about coronary artery disease. Those two terms are synonymous. We can use them interchangeably. Usually with the coronary artery disease, we're talking about atherosclerosis, or the buildup of cholesterol or fat or plaque in the arteries. Some of it's due to some inflammatory processes when the artery becomes damaged, part of the healing process if it's damaged. But it's one of the leading causes of death from heart disease. And it can come on, again, with high cholesterol diet, high fatty diet, decreased exercise. But there's a large genetic component as well. If you have family members who have had heart disease at an early age, before the age of 55 or so, you are at risk for developing coronary artery disease. And so it's very important to do the right things. Adjust your lifestyle, adjust your diet, become more active. There are screening things that we can do. There's coronary calcium scores that are available, which will tell us if there's calcium buildup on the arteries, which can be a marker for coronary artery disease and is a hint to go ahead and move forward with your investigation. If you're having chest pain or pressure or something abnormal or new onset of shortness of breath when you exert yourself, those are all warning signs that you should go in and get checked out and make sure there's not something more going on.